That's particularly true for the functional cyst. But if they are large or of the pathological cyst group, they are more than likely to cause you the following symptoms. The first is pelvic pain, and the type of pain that you experience with ovarian cysts tend to be sharp, stabbing type of pain, and it's going to be one-sided simply because it's going to cause you pain on the ovary where the cyst is at, and you know that you have two ovaries, so if you have the pain on the right side, it's likely to be on the right and vice versa. Also, women describe a sensation of being bloated and full in their pelvic area, particularly when the cyst is quite large and it's been lingering for a long period of time. For women with PCOS, what they may also be experiencing is the irregular periods, and that is part and parcel of PCOS because of the hormonal imbalance. But when these women with the PCOS type of cysts finally do get their period tends to be quite heavy because the endometrial lining has been building up for several months. If you have an ovarian cyst that is quite large and naturally is occupying quite a big space in your pelvic area, when you become sexually intimate, that is going to cause you pain because the ovarian cyst that is either within the ovary or on the ovary is being pushed and pulled, and that is going to cause disruption of the local structures, and that is going to lead to pain. So deep-sighted pain during sexual intercourse is also a common symptom of ovarian cyst, particularly when they are large. Again, another symptom that tends to happen when the cyst is large is frequent urination. So this happens because the large ovarian cyst is then pressing on the bladder, causing you to want to go to the toilet all the time. So sometimes frequent urination is not an automatic sign that you have a urinary tract infection. That's why you need to avoid going to your doctor when you have urine frequency to say, oh, I need some antibiotic, I have a UTI. You need to give the doctor the history and let the doctor make the diagnosis his or herself. Because by going to the doctor and just saying, oh, I have a UTI, you might actually be delaying your diagnosis. If your doctor is not inquisitive, if your doctor does not probe and ask questions, you will go from consultation to consultation and will have had multiple prescriptions for antibiotic when the underlying problem, which is a large ovarian cyst, will continue to be overlooked. Now, before I move on from talking about symptoms of ovarian cyst, a absolute red flag that all women that have ovaries in their reproductive years should be aware of is sudden onset of very severe sharp stabbing pain on the one side of their pelvis. Yes, that could be an ectopic pregnancy, but that is not the topic for this video, and therefore this type of pain could be related to a large ovarian cyst. Now, that usually means that the ovarian cyst is twisted on itself and ruptured. That in and of itself is not a problem as long as the ovarian cyst is on top of the ovary. Now, just to be a little bit more complicated, what can happen